Just 5 years after the COVID-19 pandemic, China faces another health challenge, an outbreak of the human metapneumovirus, or HMPV. This virus, while not new, has rapidly spread, sparking concern among health officials and the public. Social media reports, some unverified, claim overwhelmed hospitals and a dire situation. The emergence of HMPV underscores the need for robust disease surveillance and transparent communication. The outbreak coincides with a surge in respiratory illnesses during winter, complicating differentiation between HMPV and other viruses. Scientists and health authorities are working tirelessly to understand the outbreak. The situation in China highlights the importance of continuous investment in public health infrastructure and accurate disease surveillance. Accurate information must take precedence over speculation and fear-mongering. The coming weeks will be crucial in determining the trajectory of this outbreak and the measures needed to contain its spread. HMPV, first identified in 2001, causes respiratory illnesses, particularly in young children, older adults, and those with weakened immune systems. The virus spreads through respiratory droplets, similar to the flu and COVID-19. It can also be transmitted through direct contact with contaminated surfaces. Most HMPV infections result in mild, cold-like symptoms, but can lead to severe respiratory illnesses in vulnerable populations. The severity of HMPV infection varies based on age, health conditions, and the virus strain. Currently, there are no specific antiviral treatments or vaccines for HMPV. Treatment focuses on managing symptoms, with hospitalization required in severe cases. The true extent of the HMPV outbreak in China remains unclear due to tracking and reporting challenges. Differentiating between HMPV and other respiratory viruses requires sophisticated laboratory testing. HMPV infections often present with flu-like symptoms, making it difficult to distinguish from other respiratory illnesses. Common symptoms include cough, runny nose, sore throat, fever, and shortness of breath. In young children, HMPV can manifest as croup, bronchiolitis, or pneumonia. Croup is characterized by a barking cough, while bronchiolitis involves inflammation of the small airways, making it difficult for children to breathe. Pneumonia is a more serious lung infection that can be life-threatening, especially in infants and older adults. Differentiating HMPV from COVID-19 based on symptoms alone is challenging. Loss of taste and smell, common in COVID-19, is not typically observed in HMPV infections. Gastrointestinal symptoms like nausea, vomiting, and diarrhea are less common in HMPV. If experiencing respiratory illness symptoms, seek prompt medical attention for proper diagnosis and treatment. Section 4. China's proactive response to the outbreak. Chinese health authorities have taken a proactive approach, drawing lessons from the COVID-19 pandemic. China has implemented a new monitoring system for pneumonia of unknown origin to enhance preparedness. This system involves a network of laboratories reporting severe respiratory illnesses. Disease control agencies verify information and conduct further investigations to identify the causative agent. Public awareness campaigns educate about HMPV, its symptoms, and preventive measures. These campaigns emphasize good hygiene practices, such as frequent hand washing and covering coughs and sneezes. China's rapid and proactive response demonstrates significant improvement in handling infectious disease outbreaks. Section 5. Navigating the information landscape. The HMPV outbreak in China highlights the speed at which information, both accurate and misleading, can spread in the age of social media. Social media platforms can be valuable for sharing information, but can also spread misinformation and fear. Unverified claims about the outbreak's severity have caused unnecessary panic and confusion. Verify information through reputable sources like government health agencies, the World Health Organization, and established news outlets. Relying solely on social media for information during an outbreak can be dangerous. Seek information from credible sources committed to providing accurate and evidence-based information. Stay informed, stay safe, and help prevent the spread of both the virus and misinformation.